Hi everyone, and welcome to another Star Live Q&A session where we discuss current issues related to COVID-19. I'm your host Joshua Lim, and today we'll be talking about the Omicron variant, what you need to know and how to properly do a self-test, as well as an update on Malaysia's COVID-19 vaccination program for kids below the age of 12. Co-hosting this session today with me is my colleague Tina Loh. Hi Tina. Oh, Tina, I think you're still mute. Right. Oh, got it. Yep. Hi, Tina.
Okay. Hi, everyone. Now, to be very honest, I too lately have been hearing a lot of feedback and confusion about the whole Omicron symptoms and about those self-test kits, such as which self-test kits is more reliable, which method is better, saliva or nasal, to run or not to run the PCR test. And I think more importantly, we want to know the correct way or how to really live with the virus. So if you have similar concerns, please do stick around because we will try to pose as many questions as possible to the expert here tonight. Now, if you have joined us before, this guy might not be unfamiliar to you. Joining us tonight is Dr. Tan Leong, who is a UKM Medical Center emergency physician with a focus on sepsis and infectious diseases. So welcome, Dr. Tan.
Dr. Tan, I also say your mic is also on mute. Yeah.
Hello, guys. Hello, Joshua. Hello, Tina. Hello,
Hi,
everybody. Good evening.
Hi, welcome.
Hi. Welcome. Thank you.
Happy to have you back with us on the show, Dr. Tan.
So
can I have you back?
Yeah, can I just begin by asking you to tell us what are among the key differences between the Omicron variants compared to the previous ones like Delta?
Okay, basically, I think everybody have just known about this Omicron about 1 or 2 months, and I think a lot of audience here have experienced what is Omicron symptom. I guess everybody have sore throat and also running a bit of stuffy nose, but much of a very light fever. Compared with the Delta previously, the sore throat is not so common, but it had a bit of more cough. The cough is a bit more intense, and sometimes there's sputum. For Omicron, there's less. A lot of I think patients complain about when they cough on Omicron when they at the morning when they wake up, they have some blood-stained sputum. You know, when they have a little bit of cough, and because the throat is quite dry for Omicron compared with Delta. Both have a very bad headache, and a body ache. But also, one more thing is that Delta will cause a bit more, shortness of breath if it's getting worse. But compared with this Omicron, shortness of breath is a bit rather rare. Other than that, also one more unique feature. You see, Delta, definitely you have this anosmia, meaning that you couldn't smell much. You have loss of sense of smell. Compared with Omicron, this is a bit less. The smell still intact, but the taste a bit, you will have a bit distaste on Omicron. However, in Delta, the distaste and also the loss of smell definitely is more prominent. So this is roughly about this true difference between this Omicron and also Delta. Yeah.
So what I'm hearing...
What about the...
Yeah. So sorry. What I'm hearing, just as a recap, is that it's more... the symptoms are more focused on the throat. Sore throat is the primary indicator, a primary symptom of Omicron. Is that right?
Yeah, it's more to like a flu. It's more to like a flu type of symptom. Yeah, more like that. Yeah.
Mm-hmm. What about the transmission rate compared among the two? Okay.
If Delta, the R naught. Okay, I think everybody quite familiar with the word R naught. Yeah? R naught is like transmittable. It's a number for you to measure the transmittable rate. Yeah. So R naught of less than 1 means that less than 1, the disease won't transmit. Okay, or transmit less than 1 person per session. Okay, per person. However, for the R naught of Delta is 1.1 to 1.2. Meaning that every person who have positive infection, they will transmit to 1.1%. 1.1%. Okay, but for Omicron, the Delta, the R naught is roughly about 1.4 to 1.5. Meaning that every 1 person positive, it will transmit to 1.5%. So it's roughly about this quantum. So every 2% got 3%, it will transmit to 3% of that. Yeah. Mm-hmm. So it's quite fast and quite easy to transmit. Yeah.
And also one thing, Dr. Tan, I think if I'm not mistaken, the difference between the Omicron variant and Delta is that Omicron tend to attack or stay in our throat. If compared to Delta, I think Delta will attack our lungs more. If I'm correct me if I'm wrong.
Yeah, Tina, you're right. This latest mutation, Omicron, it tends to stay in our throat and replicate in the throat rather than it entered our lung. So for Delta, the best place for them to replicate is in the lung. So that's why the symptom for the throat is much more obvious for Omicron compared with Delta. This is why that's why sometimes you say distaste and the sore throat is more intense in Omicron, but Delta have more shortness of breath, difficult breathing. This is more typical for Delta. That's why this is really a big difference, yeah, a big difference for these two type of virus and variants. Yeah.
Mm-hmm. But according to what you've mentioned just now about the symptoms, Dr. Seb, it sounded so similar to our common flu. So how do we differentiate? If I do experience some flu or if I have some headache or cough, right? How do I know when should I take it seriously?
Okay. Currently, we consider Omicron or coronavirus is already endemic phase. So all symptoms of upper respiratory tract, which is you have this flu symptoms, sore throat, congested nose, even the cough, you should have RTK done, because you should have RTK performed, because we can't really differentiate, what is that, a flu or is that the Omicron, because currently the virus already mutate itself. The symptoms similar to flu, but however there's some mild difference, but I don't think a common person like us will able to differentiate, yeah? Because I can tell you that flu, definitely the sore throat is even worse compared with Omicron. Omicron is like scratching, the throat is a bit itchy, a bit of like difficult, they're swollen there, but not so painful compared with flu. Flu will have a bad sore throat or tonsillitis, or we call it pharyngitis, right? For the flu also, there will be more stuffy nose compared with the Omicron. Yeah. However, for the flu, the cough is a bit less compared with Omicron. There will be a bit of more cough, but the headache will be worse for Omicron compared with flu. And also the body ache, Omicron definitely will have more pain, more serious symptom compared with flu. This is roughly, you can differentiate these two, but generally it's hard. Generally it's difficult for you to differentiate. Even us as a doctor, we also difficult to tell you that this is Omicron or this is flu. Yeah, Tina.
So if we do experience some symptoms like that, it's better that we run a self-test at home, right?
Yeah, just do an RTK, rapid test is better. Yeah.
Okay. I do want to point out there's a question from one of our viewers that says, could it be because most of us are vaccinated so that serious infection from Omicron is less effective?
Definitely, H. Leong, definitely, you are correct. Definitely, the vaccine is playing the role, especially those who have vaccinated and also boosted. You can ask around those who have already boosted or those who have vaccinated who got the Omicron, and compare with those who are not vaccinated and got the Omicron. Do they have the similar type of the intensity of the symptom? Is the same or not? Majority of people will say, I boosted, that's why my symptom is less. Compared with those are not boosted, or compared with those is not vaccinated. Even those who are not vaccinated, they have serious symptom. Actually, they will have more serious symptom. But you want to compare with Delta, definitely Delta will be more serious. But Omicron is not less, not so. You say that it's not severe, but actually it's serious. It's quite serious as well if you are not vaccinated. Yeah. So definitely the vaccine play the role. That's why if we don't who are not vaccinated now, please go and get a vaccine done. Yeah.
What about more than just a personal anecdote? Statistically, does this also show the same kind of like similarity result that is not say dangerous, but then because do we see in the statistic manner that vaccination has kind of decreased the mortality rate as well in Malaysia?
Yeah, definitely. There is a lot of statistics and showing. Actually, in Europe and also US, there's a lot of because quite a significant group of people having a booster, and a lot of scientists also claim that because of this booster, it also tend to make the symptom less serious. But however, the mutation itself, the variant itself also become less serious, because as you know that all virus will mutate until they can stay in our body silently without causing any harm, and they want to stay as long as possible because they want our body as their host for forever. So they don't want to harm our body. That's why they try to mutate until it's like very subtle way of getting into your body and stay with you and don't harm you, don't kill you. This is what they do. So that's why when it become the Omicron, from Delta, Mu, and Omicron, the mutation definitely have reduced their virulence, because the virulence meaning that the power of causing harm to a person. Yeah. But also they have the invasion. The invasion is more intelligent. They are more subtle. They don't be like you see. Last time I did show analog with a thief. If an amateur thief come to our house, they open the door quite loud, and then everybody will the host will know that you're coming in. But for the Omicron, it's like an experienced thief. And then when they come in, it's so subtle, no sound, they come in and take everything, go and gone. This is how I always tell you, a virus is like a very cunning type of a thief. Yeah, they will always host you, take your body silently. This is what they aim for.
But what I mean is, we are at a point right now that we're looking at daily numbers which are closing into 30,000, which is kind of similar to where we were last year between July and September. But what about our death rates and hospitalization rates now that majority are getting have been fully vaccinated and are getting boosters as well?
That's good. A very good questions. You can go. Maybe you can open on a page on COVID Now Malaysia. You can see the first few chart, compare from the last year, September 2021, and today's statistic, which is on the February week, first week of February. The confirmed case, the total confirmed case is almost same now. It's like a rocket, I told them last time we have a very peak and then they come down again. And today, last 2 days, it become very high, a shoot up. And then it's similar to the last year, September, which is the worst outbreak ever. Yeah, our third MCO, remember. So that time, the death per day, the death per day is about 200 to 300 per day. Right? 200 to 300 per day. But today, because our statistics still not yet 2 weeks 20K, not yet 2 weeks 20K, right? We about 1 week plus 10K and above, right? We still couldn't see the effect yet. We had to wait until next week, which is if let's say the statistic is staying on 20K to 30K, we want to compare the death rate is the same or not. But currently, the death rate today, as of yesterday, 11:59 p.m., we have about 56 casualty, meaning patient passed away, and about 17 of them is brought in dead, meaning that they're dead at home. But the day before is about 10% dead at home, with a total of 31 dead. So with the statistic of 22K to 27K, we have about 30-something% pass away. We still cannot really project. We couldn't project yet whether 2 weeks later this will stay or not. I really hope that by 2 weeks later we already know that this is the rate of that. Then we know that Omicron definitely and booster is working. But I really hope this stay. I really hope this is the statistic that stay, or lesser people pass away. This is what we aim for. Yeah.
But so too soon. We just need a bit more time. Need a bit more time to conclude the full effectiveness of the boosters and the fully vaccine. All right. One of the viewers also asked. I think this was an article that just released. We had an article about this as well. Emily Nui asked, "Hi doctor, 34 weeks pregnant can get booster dose or not?"
Yeah, definitely can. But it's because you have to calculate your booster not exceed 37 weeks. Because after 37 you want to give birth. So usually 34 weeks is almost the cutoff, but you still can get your booster as long as you do booster. Is it booster? Booster. Yeah, can. Booster. 34 can definitely can. Not more than 37 weeks. They say.
Okay. You talk about when it comes to Omicron and just how effective it is. you talked about self-test kits and just basically testing right now, especially the number of daily cases are so high. When's the best time to conduct a self-test?
All right. Currently, there's so many self-test kits available in the markets. I think a lot of people is confusing whether how to use it, and a lot of complaints as well on review on the product saying that RTK is not accurate. Maybe there's a lot of factors that cause the RTK incorrect or less accurate. But I will assure you that if you use the RTK in a proper day, definitely you will increase the accuracy. For example, when you had contact with a person who are positive, sorry, so you count from the first day that you contact with him, and then you count three days later, meaning third day or 3 days later, or third or fourth day, you can do a RTK. That is the best time for you to use the RTK to do self-test. Because if you do too early, useless. RTK have one limitation. They need a high dose of virus load, high virus load in order to make the test positive. So currently there's a limitation on that. We couldn't make a test case more sensitive at day 1 or day 2. So it actually it created a false situation where I do today because I contact today, I do today, then definitely you won't pick it up. Definitely, and then 3 days later you got it. And second scenario is that when you have symptom, even though you didn't contact with anybody and you forgot who is the contact person, so you can count from the third day as second to third day is the best time to do. Second day to third day, you can do your RTK. It will increase the yield. Or another way is that you have to do it in the morning, early morning when you wake up, before you brush your teeth, before you gargles, before you eat anything, because you will have all the virus load highest at the time. So I assume you're using saliva, If you're using the nose swab, definitely anytime is good, But it has to be followed with my first and second condition, which is the third day or second and third day,
But doctor, I also have friends and family around me that have, arguments like which self-test kit, which method is better. Some say that, they are tested negative when they do the saliva test. They use the saliva test kit. But then after that, when they do the nasal one, it turned out to be positive. So this is argument saying that which one is more accurate, which one is more reliable. But what do you have to say about that?
Okay. First of all, technically, for the nasal, technically, if you swab with the nose swab, it's a bit hard to get a correct sample. It's hard to perform because you want to put the whole probe into your nose and go into the back of the throat, of which you will feel you're touching your ear, So for the saliva part, you would have to produce quite a good quantity of saliva come from your throat rather than from your oral cavity. So there is the sample quality is the main cause, main reason why some of them say the saliva is not good or the nasal swab is not good. It depends. But technically, both have a similar accuracy with the proper technique of taking the sample. And also number 2 is that if you for Omicron, definitely using the saliva one will be better compared with nasal swab, because the throat is the place where the Omicron replicate. But compared with Delta, definitely from lung, you do the nasal one is better, because when you breathe in, breathe out, you directly, the throat, the nose is directly connect with your lung. So when you breathe in, breathe out, the most of the virus will stay in the nasal cavity here. So for the Delta, definitely the nasal is better. For the Omicron, definitely the throat is better. So this is how I suggest to you. Currently, the Omicron is the majority, the biggest numbers of infection. So definitely the oral one is better. Definitely.
Right. So to conclude, what you mean is that it doesn't matter saliva or nasal test kit, but more importantly is how we take the sample, right? How we perform the test.
And also the timing, the technique, the timing. Yeah, these two is important. Yeah.
So in terms of timing, what I'm hearing is that the best time is in the morning. I'm assuming right after you wake up, but before you brush your teeth, right?
Yeah, better. Don't brush your teeth before you do anything. Before you do the test, don't brush any teeth. Even if you want to do at the noon time, you don't do it after you eat. You have to do it 30 minutes before eating anything or drinking any water or even smoking. You don't do smoking, and then after that you go and do swab. It won't be accurate. Yeah.
How would you clear your palate then? Let's say because if you already had a meal, how long do you have to wait, or how do you clear your mouth so that it's ready for testing?
Okay. After you have your meal, immediately you gargle with clear water and wait for 30 minutes. Then you can perform your RTK. If you can't, then you want to use a nasal swab. Then will be better. I mean, if you after eating, you use a saliva will be less accurate. Then you use a nasal one. Yeah.
But we need to make sure that we stick really up deep.
Yeah, not up. I have to warn you. Not up like this. It's up like this, in like this, directly 90-degree in, not up.
Yeah.
You poke up here, you won't go into your nasal. You just go into the bone here only. It won't get any swab. So you have to poke in. You can see it directly to your ear. You can feel the ear is touching your ear inside. That is correct. So that's why I say it's hard to do the nasal type of RTK. That's why if you hard to do it, definitely you couldn't collect the correct
get a
sample.
quality sample.
Quality one, yeah. Then
just want to segue to one of our viewers' questions over here. Hi, may I know when can elderly aged 70 to 75 who has just confirmed COVID positive take the booster dose?
Okay, immediately after you're off the quarantine, you can get your booster.
Okay.
There's no any hard and fast rule. Must be 90 days from the second dose. Yeah.
Okay. Coming back to the testing, the RTK, because there are two forms. There's the RTK, the self-test, and also the PCR. But as we look at a lot of the guidelines now, the PCR is not seen as a priority. So is it still important to do a PCR these days?
Yeah, you see, government is trying to face off the PCR test unless it's necessary. Meaning that if you are symptomatic and you are RTK negative, because you're still very worried whether you are positive, and RTK will delay. Definitely will delay. I told you, right, the third day only will give you an accurate result. So if you are first day or second day, you already have symptom, and then you have very strong contact history, definitely do a PCR will give you direct answer, because PCR can pick up a very low virus load type of sample. You can diagnose a COVID with a very low virus load, meaning that in the day 1, day 2, definitely virus load is low in our body, but you take a sample, PCR can detect that. So it also gives you clear your doubt and a faster diagnostic and more accurate diagnosis. But for us, if let's say you already have close contact or you have symptom already, definitely you need to quarantine yourself for 5 days. So if you do PCR or not do PCR, definitely you still have to quarantine for 5 days. So for us, you just do an RTK will do, correct or not? Unless there is some special situation whereby your home got a lot of other members, not sure they are contact or not, or they are in a zone C. Remember, zone C, you are zone B, they are zone C. So you want them to have a peace of mind, and also they are not sure whether you should separate out from them or not. Definitely PCR will give you a faster answer and a more accurate answer. So you can do your PCR immediately the next day after you contact the person. Directly you can get the result. PCR can, if you have one test of PCR, if negative, most likely it's negative, but there is also possible of error, but it's less. But for RTK, if you have a negative RTK, there is possible of next test is positive is high. So usually we will say, if you want to use RTK, you do 2 times, meaning that the first time you do, and then the second time you do is 72 hours later. So you give you a two time of RTK will give you a very high accuracy, equivalent to one test of PCR.
Because I have friends, experienced the same thing as well. They were tested negative on the RTK self-test, but then he experienced symptoms. That's why he went for PCR, and it turned out to be positive. And so he was like, guys, don't do the RTK, just go for PCR because it's more accurate.
Yeah, if you're affordable, why not, right? And also, if there's not a lot of people doing the PCR, you can wait. You can't wait, and you can spend some money and want fast result. Why not? Why not, right?
So it's kind of something that you kind of have to balance with, because the PCR is still more expensive
and time consuming. Sometimes you have to wait until tomorrow, right? RTK immediately, you can do decision now. Correct.
Okay. Let's kind of move to the second segment that we had today, which is vaccination for kids under the age of 12. Dr. Tan, would you mind just giving us an update about how this immunization program for kids is going so far?
Okay, as of today, about 10% of the kids who are less than 5 years old, less than 12 years old, have received their first dose. About 10%. To be exact, it's 9.6%. So far so good. Not much of cases of AFI, meaning that severe adverse effect. Basically, whoever received this first dose, the child, a lot of mothers have complained only for the little pain over the shoulder, and so some kids have some mild fever, but majority of them have some tiredness. That's all. Some kid having a hyperactive episode for a few days that really tease off the mom and dad. So I think the mother and daddy, please be patient with your kids after getting the COVID vaccine. They are a bit more hyperactive and very, they easily get irritated. Other than that, the dosing is definitely lower than our adult dose. Is about 1/3 of the adult dose. And remember, when you go to this PPV, they will tell you that this is the PITS type of vaccine. Is orange color cap. Each bottle of it can produce 10 doses. Each dose is about 0.2 ml of vaccine that going to inject on the kid's shoulder. This preparation is special for PITS, for child, but for the adult, we don't use the adult dose. The purple colored cap Pfizer for adult. We don't use for the PITS because it's too small volume and too concentrated. So as of this dose of the PITS, they have a higher volume and then lesser dose, so it's more comfortable when they inject to the child hand. And a lot of children also complain of no pain at all when they have injection. They only scared about the needles. And the current procedure also, everybody will know that whoever have child also know that it's 8 weeks apart. However, in a recommendation for Pfizer, they say 21 days and above for second dose. So our government choose 8 weeks apart, which is reasonable. So we're still waiting for the second dose to implement. So not yet started. So in the meanwhile, I think there's a lot of registration, and there's also a lot of hesitation between the parents and the KKM, because I think a lot of people will say, how about 10 years later, the vaccine will cause any harm to the children or not? It will bring any side effect or not? But for me, I rather to say survive now first before you think of 10 years later. Because if you don't survive now, there's no 10 years later. So we have to, balance out the benefit and the benefit of doubt. So for me, the decision still fall on the parents. But information, definitely you can get more. You can read more. You can get more from doctors. You can ask anything to the doctor before injection. The doctor is there for you to ask. Just ask, until you feel more comfortable before you go. And some of the parents saying that my child have these chronic diseases, whether I can bring my child for vaccination. Okay, you just register in the My Sejahtera first, and when the day come, you bring the child there, and then if the doctor say cannot or can, then you only proceed. Yeah, if you don't register now, later on when you want to register, there's a lot of people re-register, you'll be delayed. So this is what I suggest, for the parents, what should they do now? Yeah.
I'm glad you brought that up as well. I think, whatever we are discussing here in this live session, this Q&A session, is actually an educational session where people are able to, gain more perspective. But we've always said this when we're doing all these live sessions, is that whatever concerns and doubts that you may still have, the best thing to do is always consult with the doctor,
your own doctor
that you trust. Yeah, because they know your condition the best. Yeah, and I guess with the hesitation that you're talking about here, it all falls back to this: why do we need to vaccinate our kids, especially kids that are so young? And also because you mentioned that because Omicron is seen. I think one of the viewers here has brought this up as well. Is, if Omicron is seen as a milder version compared to Delta and the previous versions, then what would happen? What would really happen if our kids are not vaccinated?
Yeah. Okay. To Kieran, I explain to you why. This Omicron, very cunning. They know how to dodge our immunity. Yeah, and they like children. I don't know why they are so, because I think they are so advanced. The mutation is so advanced that they are more affinity to children. Yeah, so children easy to get Omicron compared with Delta. This is the first thing that I want to highlight. But yeah, even though the Omicron didn't cause much a problem to the children, but majority of children, they is in a group or they stay with elderly, and they are hyperactive. They are run here and there. So they are like the nuclear bomb. If they have Omicron, they will spread very fast. So if there is a vaccine for children, definitely it protects the children. Definitely this is the first thing that we want it to be happen. Number two, it protects those who are vulnerable, which is the elderly or those who cannot receive vaccine. And children can be very highly contagious because they're so cute. When you see a child is cute and then you go and hug them, right? It's so easy to, contagious. They're contagious. So that's why if you have vaccine the patient, the children, definitely you will reduce a lot of risk of transmission. Currently, there's a lot of theory about the transmission can become from children fast. I mean, the transmission of the outbreak, the case increases because of children or because of their hyperdynamic, situation. Yeah. So that's why the children need vaccination. This is much more of the reason behind. Yeah. So just
And I think when we saw the cases rising, some of the main places where we saw the rise in infections was actually schools as well, right? Where we see a lot of clusters coming. That's where when especially when numbers were rising as well. We have another question that's asking about children who had COVID-19, and so Jasmine asks, my son suffered COVID last week and just finished quarantine. His vaccination date is on the 27th of February. Is it safe for him to take the vaccine?
Yeah, as long as just finish the quarantine for child, I prefer them to complete 14 days. Only they go for their first dose. Yeah, because I think let them have some more time to regain their own body and immunity. Then only to go for that. So the vaccine on 27 should be okay if let's say it's 14 days from the first day of COVID confirmation.
I think some of the concern here is because the child has just finished quarantine and then just been cleared of COVID. Maybe the body and immune system is a bit weak. Would that affect his or her health if they went for a vaccination probably a week or two after they recovered from COVID-19?
Yeah, I that's why I said just now. If let's say you quarantine for 10 days, then you add another 4 days, make it for 14 days, only you go for the vaccine. You give more, assurance that the child is fully recovered. Then you have more, more. And
possibly seeing how's the child's condition after that. Yeah. Again, whatever concern, if you still have concerns, again, ask the doctor that you trust. Let's see. We're just going to go through some of the questions that are posted by viewers.
Yeah, I think I need to just add up for those who are, I think there's some comment about the child will infect other people. Definitely, any vaccination will reduce the chances of transmission. There's a lot of data now. So I think I should add on just now for the explanation why the children need, the vaccination. Definitely, vaccination can reduce the rate of transmission, especially booster, even better. But for child, no need. Yeah.
Okay.
Thank you.
When Irene asked, when a child had their vaccine, has had their vaccine, is it advisable to let them stay in for a few days as their immunity may be down?
Actually, for any person, not only child, for any person who do the vaccination, they are advised to, not expose themselves to any COVID yet, because the immunity is not yet built. Meaning that the immunity toward the COVID, not because of their immunity is low, because the immunity is not yet built on COVID. That's all.
And also maybe because of the side effects, right? Yeah.
Yeah. Sorry again.
Yep.
Sorry again.
Tina?
Oh, I wanted to ask also, but what about those who already they are tested positive, as in they are already infected positive? Does that mean they are immune now, as in they are safe now? I won't get infected again.
Okay. Remember, COVID got so many family members. Yeah, they have Omicron, got Mu, got Delta, got so many names. Yeah, as you name. Each of the COVID variant can reinfect you again. Meaning that if today we have Omicron, you cannot guarantee tomorrow you won't get Delta. So this is the problem. Vaccine can cover all. But if you want to, vaccine can reduce the severity, can reduce the infection rate. Definitely now there's a lot of data to suggest that vaccine really can prevent the transmission, can reduce the R0. So that's why I say if a new variant, you can still infect by new variant or the old variant which you never exposed before.
Yeah.
So but the same variant?
No, same variant, you're definitely not. Definitely not. Unless you are stage 4, stage 5, those persons who have already infected with COVID, stage 4, stage 5, they are so serious that they didn't have natural immunity after they recovered. So this person can reinfect with the same type of variants. Same type, yeah.
So, but in terms of being reinfected with the same variant is not as likely, but there's a higher percentage if it's a different variant, maybe going from Delta to Omicron or even the base COVID.
Yeah.
Rachel asked, if the index case is Omicron or Delta, is it possible for the infection to be otherwise? So I think what she's meaning, if the origin of the infection maybe from the cluster is a Omicron, would it be a Delta somewhere down the line of the infection chain?
Meaning that if index meaning is currently is Omicron, majority Omicron, you mean?
Yes.
There's still a lot of Delta and also Alpha, Mu, all still there.
But it won't come from someone who has Omicron and then it becomes Delta, right?
No, it won't change like this. It won't change. Meaning that if you got Delta, now it's Delta. But you can have superimposed two type of variant infection together. That is possible because there's a lot of cases overseas that shows that three type of variants together in one body at one time. So it's possible. But it won't change like this. It won't change like Omicron become Delta, Delta becomes Omicron. It won't do like that. Yeah.
Okay.
Okay. Let's see any other questions.
Michelle asked, would like to ask between Sinovac and Pfizer, which one is more suitable for the child?
Sorry. There is the evidence currently only Pfizer's that is suitable for child less than 12 years old. There's a lot of paper already published on this, even in New England Journal, Lancet, all is going to only Pfizer. Sinovac recently, I think Hong Kong, they have started for 3 years old and below. 3 years old and below. So I'm not sure how it's, 5 years old and below, sorry. So I'm not sure whether it's feasible or not. I'm not sure. But Pfizer definitely, yes, is safe for child. Yeah.
Okay.
Okay, I think one of the general, more kind of like the big picture question is how do we, as it's going, as COVID is going endemic, becoming endemic, and we're seeing a rise of cases, but because people are fully vaccinated, perhaps some of the symptoms are not going to be as serious as what we've seen in 2021 and 2022. But how do we live with the virus now?
Okay.
Because it's kind of like do we have to normalize RTK testing? Do we and just quarantine again? Like, how do we live now?
Okay. Currently, the government have moving the PCR become RTK, which is they give you the power of self-diagnose. Means that you can, anytime you can self-check yourself whether you have COVID or not. Okay, and they give you the power of you can really, quarantine yourself. They give you the power to choose. So the responsible is shared together with government. So this is how the government want our endemic to be. It's like dengue, you see. Dengue, government will come to your house to spray or fogging everything, but yet you still have to do some exercise to, to drain the water or to unclog the drains to reduce the infection rate, right, of the dengue. But however, when you got dengue, you come to hospital will do a proper management on dengue. This is how endemic should be. Like now, COVID, you had the symptom, you do self-test, positive. If you need to come to hospital for treatment, they'll treat you. After you go back home, and you live with it again. But they give you one more option is you have vaccine, means that you have more choices of protect yourself by using vaccine, and then you can use a face mask. Later, I'm not sure the face mask will face out or not, but you see UK and US, some of them don't wear face masks. The rate of infection is almost a million a day. So there's a pro and cons for currently still not too I think it's a bit too early to say that you off the mask because Omicron is so easy to spread. It's about 70 times faster than Delta. So I feel that it's still not yet it's not an option for us to take off the mask. Currently the cases why it increased so much. I actually Malaysians is quite obedient. Our Malaysians is quite obedient. They really wear masks everywhere. I seen everybody's follow the SOPs quite correctly and quite strict. However, there's one place that we miss out is when we see our friend and we eat together, we take off the mask. And unfortunately, this is a time where they spread. Especially this last festive holidays about the Chinese New Year, a lot, seeing friends here and there. When you just take off the mask and then you eat together and talk together about 5 minutes, you already got the disease. But if you are with the same family for the whole the whole festive holiday, definitely you are less risk of when you take off the mask, also you won't get infected. If you sit next, if you go to one restaurant, the table to table is quite far away, and you only sit with your own family members, the risk is low, still very low. But one person from other houses or from your friends come to your table and sit there and eat together, then they will increase the risk. So that's why I said when you go for any function, any gathering, I think an RTK will be good before you do an RTK before you go. Or if you have symptom of flu, don't go. Better don't go. And just tell them, sorry, I can't go. This is how we should do now.
Better to be safe than sorry.
Yeah.
But doctor, sorry, Josh, you can go ahead.
Oh yeah, one of the viewers asked, how long do they have to wait after the COVID-19 vaccine to vaccinate their children with another, probably like a flu vaccine?
All right, 14 days apart. Any vaccine prior to COVID vaccine is 14 days. Meaning that our government have set the rules that if you are following the national child vaccination schedule, that is a priority first. That will be your priority. Then only second only to be to receive the COVID. So if today you have to get your hepatitis B, let's say your child had to go for hepatitis B, so you have to wait about 14 days only can get your COVID vaccine. 14 days minimum. This is how. But
the any national program vaccine would have to be prioritized for the COVID vaccine.
Yeah, okay. They are the most priority. Yeah.
Okay. I think this comes back to kind of like what we were talking about vaccination for kids, and just maybe vaccination in general for children after they are vaccinated. Are they unable to transmit the disease to others, or it reduces the chance for them for the virus to mutate into new variants, which is more dangerous?
Yeah, Andrew, both is correct. So first of all, if when you had this vaccine to you, actually you reduce the rate of transmission. Definitely you reduce. It won't reduce 100%, but it reduce. Okay, but when you reduce the chances of transmission, definitely you reduce the virus to mutate, and also you let the virus. How a virus mutate is when they stay in our body too long. Okay, when you have vaccine, the virus won't stay in our body longer. They will shorten the time of infection, they shorten the time of symptom. So it gives the virus no chance to mutate. That's why vaccine will reduce the rate of mutation itself. Understand? So because we need the host, you need to host the virus for a long time, only the virus can mutate themselves in our body. So that's why those who are not vaccinated, they have a prolonged infection, especially virus that stay in their body in 1 or 2 months. Definitely they will promote the the mutation. That's why vaccine plays a very important role here. Yeah.
But before this, before we actually started the vaccination program for kids, especially kids below 12, we were told that that they weren't a priority because they have better immunity, better recovery. COVID is not going to affect them as badly. Why do they need to be vaccinated now? I guess as one of the viewers asking.
I think this is why you say, oh, the symptom is so mild. The symptom is mild is because you are boosted or because you're vaccinated. But for child is not yet vaccinated. I told you before. When you are not vaccinated, the symptom will be more serious. However, for children, even though not vaccinated, the symptom a bit mild, but they still have a very high risk of getting severe COVID, especially MISC, multi-inflammatory syndrome, multi-organ inflammatory syndrome. This can cause death to a person or for a child. There's a lot of cases reported. If not vaccinated, got COVID, and then it becomes serious, then the child lost their life because of MIS. So this is why the risk of getting COVID in the children, even though the symptom is low, but there is a risk of getting severe COVID. And the risk is a bit high if they are not vaccinated compared with those child who are vaccinated. Understand? This is what we're concerned about. We rather to tell you the risk and benefit, you have to really balance it up. Yeah, it's your choice. It's your choice. You want to vaccine or not, because this is national program. They don't force the children to inject, but if you want, they already offer it to you.
I see. Well, thank you very much, Dr. Tan, for spending the time tonight to share all these insights and perspectives regarding COVID-19, the Omicron variant, and also how the vaccination program for kids under 12 is doing. So before we conclude, if anyone has any further questions for Dr. Tan, you can actually log on or check out his Facebook page, which is Dr. Sepp, or Wen Dr. Sepp, Ask Dr. Sepp. His TikTok, he's actually doing another live session later, right?
After this,
about 10 o'clock is in BM, so you can join me in the TikTok live sessions to further ask any questions there. I can try to explain as much as I can. Thank you.
Which is TikTok handle is at Ask Dr. Sepp. And again, we just want to thank you for taking this opportunity to help educate us. And if again, for the viewers out there, if you have any other concerns, you need something that is more specific towards what you are facing, the scenario that you're facing, it's always best to go and check with a doctor that you trust. Okay. Without further ado, we're going to just conclude this session. And for more updates, be sure to check out the STAR's Facebook, YouTube, and also website. Everyone, I hope everyone stay safe, stay healthy, and have a great week ahead. And good night.